Hi, good evening, everyone. My name is Jeanette Moreno, and today I will be presenting on protecting patients and nurses, why legal nurse to patient ratios are essential in the healthcare community. Today, we're going to talk about how this issue impacts every hospital, every nurse, every patient, the need for legal enforced nurse to nurse patient ratios. This topic matter this topic matters because understaffing doesn't just make the job harder. It makes patients' care unsafe. Nurses are the backbone of healthcare, yet they are consistently assigned workloads that exceed what is safe for both of them and people they care for. Without legal protection, staffing decisions are often based on budgets instead of patient needs. My goal today is to show why safe staffing ratios are essential, how they protect patients, how they reduce nurse burnout, and why they must be mandated by law rather left to hospital discretion. Nurse to nurse patient ratio matters because patients' outcomes directly depend on how many people a nurse is responsible for. Nursing, not a task-based job. It's continuous monitoring, decision making, rapid responses to emergencies. When a nurse has too many patients, they cannot provide the careful assessment or timely interventions required to keep people safe. This isn't about nurses working harder. It's about unrealistic expectations that simply are not met safely. A nurse cannot be in 5 rooms at the same time. Ratios ensure patients receive appropriate monitoring, medications are given safely, and emergencies are recognized early. In short, ratios matter because lives depend on them. Right now, the healthcare system faces chronic understaffing. Many nurses regularly care for 6 to 8 patients at once, especially on medical surgical units. Research shows that when nurses' workloads increase, so do negative outcomes like infections, falls, and delayed care services. Nurses report missing vital tasks like turning immobile patients, performing full assessments, updating medication charts, and educating families simply because they do not have the time. Miscare leads to complications that could have been prevented. It also creates moral distress among nurses who feel responsible for consequences they cannot control. The problem isn't a lack of dedication, it's a lack of staff. Impact on patient safety. Patient safety is the strongest argument for mandated staffing ratios. When ratios are safe, hospitals see fewer medical errors, fewer pressure injuries, fewer hospital acquired infections, and far fewer preventable deaths. Studies in major medical journals show that for every additional patient added to a nurse workload, the risk of death increases by 10%. That is a huge number when you think about how many patients a unit cares for. Safe staffing isn't optional. It determines whether a nurse can catch a subtle change in vital signs, notice a patient's declining condition, or respond quickly during an emergency. Ratios allow nurses to deliver the level of care patients deserve. Impact on nurse burnout, which is very huge on how nurses have been affected and how it also affects their mental health and their physical health. Unsafe staffing doesn't just affect patients, it severely impacts nurses. Burnout is extremely high in the nursing profession, and excessive workloads are one of the biggest contributors. When nurses are constantly overwhelmed, they experience emotional exhaustion, physical fatigue, and a loss of job satisfaction. Burnout is one of the main reasons nurses leave bedside care or leave the profession altogether. When a hospital fails to retain nurses, turnover increases, which leads to even more understaffing. It is a dangerous cycle. Safe staffing ratios have been shown to reduce burnout by around 30%. Ratios give the nurses the ability to provide care and safely without feeling rushed or guilty. And that leads to better retention and a more stable workforce for our nurses. The research supporting nurse to patient ratio is extensive and consistent across multiple states and countries. Organizations like the American Nurse Association, the Agency of Healthcare Research and Quality, and the CDC all agree that safe staffing saves lives. One well known study by Dr. Linda Aiken found that each additional patient increased mortality risk significantly. Other studies show that safe ratios reduce complications, improve hospital ratings, and even lower patient length of stay. When we look at the evidence, it becomes clear that nurse staffing is as important as any medication or treatment. Adequate staffing is a proven evidence based way to improve outcome and save lives. California is the only state with legal mandated nurse to nurse patient ratios, and it serves as a powerful example of what happens when hospitals implement safe staffing. After ratios were established, patients' mortality decreased noticeably. Nurses in California reported less burnout, fewer workplace injuries, and higher job satisfaction. Patients received more timely care, and hospital does not collapse financially as critics predicted. They actually adapted successfully. California nurses have more time for patient education assessments, documentation, and collaboration with the healthcare team. The law has been in place for 20 years, proving that mandated ratios not only work, but create sustainable improvements. A common argument against staffing ratios is that they are too expensive. But the cost of understaffing is actually higher when we consider preventable complications, readmissions, lawsuits, and staff turnover. Hospitals spend far more money replacing burned out nurses than they would hiring enough staff in the first place. Another argument is that there aren't enough nurses. However, research shows a large number of licensed nurses are not working in hospitals due to unsafe conditions. When staffing improves, many nurses return to bedside care. Lastly, hospitals claim they need flexibility, but flexibility should never come at the cost of patient safety. Safety must be the priority. Legal enforcement is the only way to guarantee safe staffing across all facilities. When staffing is left to hospital executives, decisions are often based on financial goals instead of patient needs. Vol- Voluntary guidelines have not been effective. Without laws, staffing is inconsistent. Some days a unit may have enough nurses, and other days it may be dangerously understaffed. Legal ratios create a standard, just like other health and safety regulations. Just as hospitals follow sanitation rules and medication protocols, they should also follow rules ensuring enough nurses are present to provide safe care. Laws make hospitals accountable. To improve patient safety and protect nurses, we need to support legislation such as the Safe Staffing Act and advocate for safe ratios at the local and national level. Nurses, student, educators, and community members all play a role. Speaking up, sharing information, and supporting policies that prioritize safety can lead to real change. When we advocate for safe staffing, we're not just protecting nurses, we're protecting every patient who walks into a hospital. Safe staffing saves lives, reduces burnout, and strengthens our healthcare system. It is time to make it legal requirement, not just a recommendation. Thank you for listening to my speech.